So we are live now.
All
Dr.
right.
Choy, how are you, buddy?
Good.
So we are here in the middle of nowhere, Pennsylvania, charging the Tesla. But the town must be big enough that they have a Starbucks, so we're very excited. So what's going on, dude? How's life in Cali?
It's good. I'm in private practice. You can see I'm in my office right now. I just saw my last patient.
Nice, man. Well, thank you so much for joining us. I know we've been trying to coordinate a time, and I've been really bad. This journey has turned out to be much busier than we had expected, because we thought, oh, 6,000 miles, 10 days, we're gonna have a lot of time. But we've had a lot of opportunities in all the cities to engage the community and also raise awareness through the media, which we've been very blessed with. So, I'm sorry it's taken some time, but I'm very excited to have you on with us, because I think what you do is very underserved in men, and most people don't even think about it. And most people, when they do think about it, just put the word crazy in there. And I will tell you, I've had some, personal issues as well, and I've seen people in your field, and it's just always good to have someone to talk to. So thank you so much, Dr. Choy, for joining us all the way from Cali, which hopefully
Yes.
I will be there in 5 days as well. So tell us, Dr. Choy, where exactly is your practice, and do you specialize in anything specific?
Yeah, I'm in, my practice is in Los Altos, California. That's a small town south of Palo Alto.
Hmm?
All right. Yeah, right by Stanford. So it's in the San Francisco Bay Area.
And then, so San Francisco, you like living there?
Yeah, love it. Born and raised here, so like to be back home.
Yeah, so you guys may not know this, but me and Dr. Choi were at Boston University together, and he was very cool back then, and he still looks very cool right now. So him and his friends always got me into the clubs in Boston.
Yeah, we did our OB-GYN rotation together, right?
So that was a lot of fun.
Yeah.
So tell us a little about mental health disorders. Is it just in the head, or is this like a real science behind it?
Well, I think a lot of people would argue that it's, depending on who you ask, of course, I'm going to say that it is a real disorder. I mean, there's a lot of science and biology behind it.
Yeah.
But most people, especially the general public, probably think that it is all in your head. Yeah, and I think part of the reason is that it is hard to diagnose mental disorders. There's no real lab test or any type of imaging that you can do to diagnose a disorder. And even within the field of psychiatry, that you may see two different clinicians and come out with a different diagnosis. So maybe there's not as much consistency or standardization across the diagnoses.
I don't think that's just in your field. I mean, if you look at, what I do, I mean, on a physical exam, I may measure a prostate 40 grams, someone else may say 45 grams, but the intervention is still going to be the same. It's going to be based on the symptoms. So, I agree with you. I mean, I would say psychiatry does it's a little broader in the things you can diagnose. Like, I thought I was depressed, and then, I was told I was a seasonal affective disorder, but the symptoms are the same.
Yes.
But I think the problem is everyone goes to Dr. Google to try to diagnose themselves when they should be coming to see people like you. Don't you agree?
Yeah. I mean, well, the internet does provide a lot of information. So sometimes it's pretty good, like the information you find online. But self-diagnosis, of course, isn't the right thing to do. It's always best to meet with a clinician.
Yeah. So tell me, in men, so obviously we're trying to focus on men here, 6,000 men over the next 10 days. 6,000 miles over the next 10 days. Hopefully 6 million plus men will be engaged. But, are there any mental health disorders that are more prevalent in men?
Well, before even talking about mental disorders, I wanted to talk about maybe even emotional health. I mean, I think a lot of people now may not even recognize what it means to be emotionally healthy. And by the time somebody presents themselves to an appointment or a visit with a clinician or a psychiatrist, that their symptoms are quite severe already.
Mhm.
And although I am a psychiatrist, I try not to prescribe or push antidepressants or pills on patients
Mhm.
unless their symptoms are quite severe.
Mhm.
But most of the work can be done just by recognizing what emotional health is.
Okay.
And,
What is emotional health?
let me ask you, what do you think emotional health is?
I mean, I would say, um, the ups and downs, and making sure that you have self confidence and that you don't get really worked up by anything. Um, like the best example I could think is me and my wife. The days we're communicating better and the days the kids are behaving, I would say we're much more emotionally healthy. But then
Mm-hmm.
other days we're not.
Mm-hmm.
But I don't know if that's the proper term.
Yeah, I think you're touching on the important aspects of it. I mean, just dealing with problems. I
Mm-hmm.
think everyone has issues and problems, and doesn't mean it necessarily has to be a disorder.
Mm-hmm.
I think some people might think what it means to be emotionally healthy is to be happy.
Uh-huh.
But there are other feelings that are core basic emotions, like
Yeah.
anger, sadness, and it's important to be able to be aware of those feelings.
Yeah.
Be afraid, to be anxious. And most people would tell themselves, if they do feel sad, don't be sad. And they would
Mm.
try to force or control their
Oh.
feelings to be happy. So the
Mm-hmm.
important thing, how I tend to think about emotional health, is having the ability to, one, recognize and identify what your feelings are at that moment.
Mm-hmm.
Because emotions, it is a fleeting state, but it's important to recognize the feeling that you're experiencing in the moment. And once
Mm-hmm.
you do, you can acknowledge the feeling and learn to tolerate the feeling. And most feelings are unpleasant. Like
Mm-hmm.
there's other feelings like guilt or shame. And once one can tolerate the feelings, they can learn to manage those feelings and then communicate and express them in healthy ways. Um, I think when people get into a denial of their feelings is when unwanted behaviors will soon surface or emerge or are created. And most men don't talk about their feelings or don't acknowledge their feelings. And
So you're saying it's okay to cry?
yes, it is. Um, it may not be appropriate in some places, but it definitely is okay to cry.
But I feel like men do show emotions, but they may not show it the right way because men are more prone to having rage and more prone to having aggressive behavior. So is it just in our genes that we're more prone to aggression, or is it just more what you're talking about is we don't know how to handle our feelings, and that's the only way we know how to manage it, like screaming and hollering and I'm not knocking down walls, or
Mm-hmm.
is there another way to do that? Is like let that aggression out at the gym instead. Like how do you like help people that have negative ways of expressing emotions to do it in a more positive way?
Well, so going back to the emotional health, I think men who do express anger with rage or acting out or getting violent, they may not even acknowledge or admit that they're angry when they feel the emotion of anger and they act out. So they're not tolerating the intensity of that feeling. Um, so and people who do have impulsive behaviors, it could be an underlying mental disorder. So it's important to get the symptoms checked out. But most people who do, I mean, get into, I guess, men who do show rage or become violent, they have to learn to recognize what sets them off, what triggers them. So, and usually, it's not the person who acts out with rage that seeks treatment or think it's a problem, because they're probably blaming the other person that caused them to be angry.
Hmm. So 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 how, so we mentioned aggression and stuff is very common in men, and but what about like one other thing I read is like things like suicide or
Mhm.
depression. All that stuff is it true that it's more common in men?
Um, is suicide more common in men? Well, suicide attempts are more common in females, in women.
Yeah.
But the success, if you want to call it that, of suicides are greater in men, because men, they do use more lethal methods, like firearms, whereas women tend to overdose on medications and not necessarily complete their suicide.
Wow. So then, what about depression?
Depression, are men more prone to depression than women?
I don't think they are, but I know I would think it's. I was reading somewhere, and this is all this is not based on any research paper I read, that they are prone to depression, but they usually don't seek treatment until later on.
Yes.
But I think that's just a problem overall with depression. I don't think it's just male depression,
Mm-hmm.
especially in like the geriatric population. Wouldn't you agree? A lot of I see a lot of males that come to my office for treatment of erectile dysfunction or think they have low testosterone, and then I do a full workup, and then I'm like, do you ever think you're depressed? And that leads into a conversation about depression, how they recently lost their wife, or their daughter's not talking to them or something. But I just feel like I don't always have the time for that.
Mm-hmm. That you don't have time to talk to your patients about their...
No, I do. I have time, but to get into deep that with them or build that relationship where they trust you with that kind of information.
Yeah.
It did take a few visits or hours, and they're coming to see me for erectile dysfunction. I don't even know what to do at that point in time. I usually say, talk to your primary care. I'll call their primary care. But I mean, how do I efficiently get them to someone like you, or get them to realize that they need intervention?
Yeah. Well, I think you can even say to your patient that you think that ask them how they're feeling about what you're talking to you about, and just show that you're concerned about their mental health, and ask them whether they've considered talking to a professional. You may not necessarily need to refer them to a psychiatrist, maybe even a therapist, because I think a lot of patients are worried that if they walk into a psychiatrist's office that they're going to leave with a prescription for medication, and they don't want that. So
that's a problem in every medical office. I mean, that's what everyone assumes with me too, that I'm going to put a surgery on them. So,
yeah.
But this is pretty enlightening. I mean, I wish there was more out there about mental health disorders, and because I would say therapists and counselors and psychiatrists are very easily accessible. It's just people just don't go to them when they should.
Mm-hmm.
And I really feel communication is key. There was a study done a few years ago that said couples that communicate better lead healthier lives. And I think that's in general, whenever any couple or any man or any friend communicate with them, I think it definitely is better. And but sometimes it's hard to communicate when you have emotions in the way.
Yes. Yeah, that's part of the problem. Yeah. And I absolutely agree. Most people tend to seek help when they've exhausted all other type of coping skills or resources. So symptoms tend to be more severe.
Yes.
And harder to treat by then. Just like not even in mental health, but in just general physical health. People don't really practice preventive health care. It's more wait till there's something.
Yeah, that's what we're trying to do, man. We're trying to tell people your body's like a car. You got to go get that preventative maintenance because you want to get the full 100,000 miles. So, Dr. Choy, top three things that men need to know about their mental health. Number one.
That they need to know about their mental,
You mentioned emotional stability, right?
All right.
Number two.
Yeah, you kind of threw this. You kind of surprised me with this one. All right.
Oh, no. You just have to summarize everything you said. It's emotional stability. We have to have good communication. You have to know how to control your emotions.
Yes. Yeah, recognizing your emotions, knowing how to communicate them, and being able to manage your emotions, so you can learn how to manage your decisions or make the decisions and the behaviors that are healthy.
Yeah.
Instead of letting your emotions control you, you can tolerate your emotions and let your emotions be a sort of a compass for you to decide on how to live your life. Because I think a lot of people who are not emotionally healthy tend to let their emotions control them.
Well, are there any online sites that you usually recommend? I know, like for urology, there's like the American Urologic Association. Like, is there any like mental health or a website that you usually recommend, other than someone just typing in "I'm depressed" or "I'm sad"? Are there any like good resources online that you're aware of?
Um, I can't think of one right now, but I think if you can just Google emotional health, that comes
Yeah,
up a lot, and usually the definition of that is pretty standard.
yeah. Okay, well, that's cool, man. Well, Lawrence, it was great talking to you, man. You're
Yeah,
such a rock star, and you're still so well dressed and proper, and your hair is still side parted. I love it.
thanks, and I love what you're doing. It's amazing that you're promoting all this like campaign about men's health and helping men understand their health better.
Yeah, I mean, we've been very blessed. We're getting, as I mentioned earlier, a lot of good engagements in the community at the various universities. Lots of great webcasts with experts in the field like yourself, and for once, we're getting really good media attention as well on this topic. So, hopefully, if we can save one life, 10 lives, 10 million lives, we've done our good deed. So. Uh, So every guy out there, please take care of yourself. And if there's anything, frustrating you internally from a mental standpoint, there is definitely excellent help out there. So Dr. Choi, thank you so much, man.
Oh, you're welcome. Thank you. It's been great talking to you.
All right, Lawrence.
How come
If
you
anyone
don't
has
make it
any
up to
questions,
Northern Cal? How come you're not able to come to Northern California?
and 10 days off from work, man, and from the wife and kids, it's tough to begin with. But I think next year we are trying to come. So we will definitely come over to where you are and have a big party. So,
All right, get some rest.
all right, Lawrence. Thanks, buddy. Thanks, man.
Okay.
It's good chatting with you.
Okay.
Bye.